Hey, Doctor, it's Alan. I want to talk to you today about describing treatment to the patients, what works and what doesn't. Now, each doctor has their own personality, their own style, but one thing that I've noticed that works throughout all of the different personality and presentation types, providing options versus developing confidence. Some of the doctors, what they do is they'll sit down and they'll explain to the patient all of the options that are possibly available to them. It creates a lot of confusion and they get into this analysis paralysis mode. We can see it in the patient's face, and I'm the one that they talk to after they get out of the chair a lot of times when in the front office, and they'll express to me that they're not sure which of these options is best. They're confused about how to proceed. I see other doctors, and when they're presenting with confidence. Is this a high aesthetic case? Is money a concern on this case? Or is this a money is no object? I want the kind of the value option. They understand that about the patient. So when they go to present the treatment to this patient, they're able to tailor it to the patient and their patient's needs so they're able to build confidence in their recommendation. They might have the implant option versus the bridge option versus the pull them all and just put an implant supported denture option. But based on their understanding and knowledge of the patient, they're able to present that treatment to them in a way that focuses the patient on the option that the doctor feels is going to be the best fit for the patient's need. And in doing so, it provides that patient with the confidence from the doctor that this is the right thing to do. This is how we should move forward. Most doctors have been to some sort of a financial planner before. So imagine you go to a financial planner and he sits down with you. We have a bunch of different vehicles that you can put your money in. Stocks, or we can put your money in bonds, or you know what? There's crypto these days. There's these REITs, right? Or cash is king. And then they give you three more options. I need to think about it. Maybe I should talk to another financial planner. So you go in and you talk to another financial planner. The financial planner sits down with you and says, let me find out a little bit about you, doctor. And he or she starts asking you questions about, what's your risk tolerance? Do you want high risk, high reward? Do you want to keep it safe? What's the time frame of, you know what? Based on what you've told me your needs are, I think that just getting a good, solid mutual fund in the stock market is going to be the best scenario for you. You're much more likely to go, you know what? This guy understood my needs, presented me the options, and then gave me confidence that this is the right one. He's the professional. They're making a recommendation that I feel confident in. I'm going to move forward with it. I'm ready to move my money over to you. This is the difference between providing options and then creating confidence. That's what they're paying you for, is to provide an opinion. This is what I think is best for you. Some doctors say it along the lines of, if you were my sister, this is what I would recommend. If you were my daughter, this is what I would recommend. The simple one is a bridge versus implants. The patient either is missing a tooth, or we're going to be extracting a tooth. And then we have a bridge option, we have an implant option. Which one do we confidently recommend to the patient? Factors that go into it are, the first one is money. If the bridge is covered and the implant is not, and money is important to the patient, then that might lead you towards the bridge option versus the implant option. It's like it could be a few $100, $600-700 a copayment versus $3,000. If that is a make or break deal for the patient, that might lean you towards the bridge option. Other factors that would lead you towards the bridge would be things like surrounding teeth either have or need restoration. I see a lot of times it's like you have a row of bombed out teeth. We're going to pull this one out. And they're like, oh, implant. And the patient is like, well, I can't pay for all of my dentistry. And in my mind, I'm thinking, well, we're doing crowns on the two surrounding teeth anyways. And it's covered by insurance to do a bridge versus an implant. This is probably leading me towards the bridge option. Money is not a concern for the patient. And then obviously I would lean towards the implant. Fillings is another one. So, and this goes back to the definitive dentistry versus conservative dentistry. I see a lot of negative Yelp reviews where the doctor tried to Frankenstein piecemeal this tooth together with a bunch of composite, and the thing breaks. And they go to another doctor that's like, this is a crown, and they just crown the tooth. And so doing that like Superman dentistry is something that I would avoid in general. What you tell to the patient chair side, as far as that it might not work, is really, a lot of times the patients don't hear that. It's like, that guy tried to fix it. I paid him money to fix it. Now it's broken. We get ones where it's like the tooth then shears off. The patient's like, we got to do a free root canal build up crown for a $200 filling that we did. And we just kind of put ourselves in a bad situation by trying to do the Superman dentistry. These are for larger cases. These are do we try to save the teeth and just fix it as we go? Or do we just bite the bullet, remove them, implant supported overdentures, or whatever the recommended solution is? I just explain it to them. I say, listen, we're able to save 12 of your natural teeth today. However, The reality is, based on the history that we've seen, these teeth are probably going to fail over time. So you're going to need to continually come back. We'll fix those teeth as they come back, or replace them with implants as needed. Option B is we remove and give you implant supported overdentures. And then I just explained to the patient. Some people are like, I don't want to have to keep coming back and spending more money as these teeth fail over time. Let's just get it done. Other people can't mentally get themselves wrapped around the fact that their natural teeth are going to be removed. Open and honest conversation with the patient. And as soon as they give me an indication, great. And then I can present with confidence, this is the option for you. And then just kind of walking through the process. Understanding the patient and then being able to present an option that you think is the best fit for that patient with confidence, this drives case acceptance and really patient satisfaction as well. The patient that ends up paying us the most money, those are typically our happiest patients. They like us, they trust us, we do a good job. The patients wear nothing with us and they leave and they're still in whatever kind of discomfort or pain or that they came in with, those patients don't really like us very much. What I like to do is I like to find out something about the patient before I go in and talk with them. And I get this from the TC or sometimes from the dental assistant. For my female patients, I'll find out a little something about the family or the community or something like that. And for the male patients, a lot of times I'll find out something about their job. Hey, Amy, I'm Alan. I heard you've been living here in this community for 33 years. I grew up here, never could leave or whatever. And we have a little conversation about something other than her teeth. Another one. Hi, Bobby. I'm Dr. Allen. Nice to meet you. I heard you just started a new job down the street at Chuck E. Cheese Pizza. Other ones would be, hi, Linda. I'm Dr. Allen. Nice to meet you. I hear you have 8 dogs. Tell me about this. It's going to relax the patient. It takes 15 to 20 seconds. Having this little tiny nugget of information to come in and open up the conversation with the patient about something other than their teeth creates a connection between the doctor and the patient that is difficult to replicate when you're talking about teeth. After I'm done with that, then I'll move into the teeth. I'm going to take a look at everything, but I'll focus on that lower left-hand side. We'll make sure you get taken care of today. Right there. We'll make sure we get you taken care of today. And I want that to go into their subconscious mind. Oh, we're getting this done today. I'm going to lean you back, take a look under the hood. I do not want then to show them the x-rays and photos right away and explain the treatment. No. We need to make sure that on the right-hand side computer, the patient sees the big number first, right? If you don't remember that, you got to go back and watch your new patient process video. What I do is I'll lean the patient back up, put my hand on her shoulder. Linda, I think I've got everything. Give me a couple minutes. I'm going to get it entered in the computer, and then I'll come back and explain the treatment to you. The x-rays are for you, doctor. The photos are for the patient. And the magic words you want to hear from the photos is this. You want the patient sitting in the chair, are looking up at the screen, and you want them to point at that, and you want them to say the magic words of, is that in my mouth? And as soon as you hear that, there's somebody that's ready to get their work done. Linda, with her 8 dogs, that's lived in the community for 33 years. I'm going to make the recommendation. Let's go with the implant option. I think it's going to be a better one for you. I'm going to lean her towards that recommendation, as opposed to maybe her son that just started at Chuck E. Cheese Pizza, has dental insurance for the first time, has a bunch of dental needs, and here he's got a tooth we got to pull out, and is this going to be an implant or a bridge? I might lean him towards the bridge option because his copay on that is $700 versus the $3,000 to get the implant done. Oh, and by the way, the bridge will cover not just the one missing space, but the 2 crowns that need to be done next to it. He kind of gets 3 teeth for $700 or $600 rather than 1 tooth for $3,000. I'm going to guide the patient. I'm going to give them confidence in my recommendation based on my understanding of the patient.